I'm Dr. Colleen Cotton. I'm an associate professor of dermatology and pediatrics at the George Washington University School of Medicine and Health Sciences, and I'm an attending physician and director of our multidisciplinary pediatric HS clinic at the Children's National Hospital in Washington, D.C. Excellent question. I think first and foremost is to refer and refer early and also recognize, not everybody is comfortable treating children. Not every dermatologist or every surgeon out there is comfortable escalating care if a patient has more severe HS. And so if you feel like your patient is not well enough controlled, that could just be because they have severe disease, because HS is a very difficult disease to control. But if they're being told that they're not eligible for escalation of treatment just because of their age, they should probably be seeing somebody else because we do have to use off-label medications frequently. And again, as I said, we want to get them in that window of opportunity. We don't want them to get so bad that the treatments we do have are not really going to be helpful to them. Um, how they can deal with school and with peers is a really, really huge thing. So if you have someone who has tunnels that are draining, for example, hooking them up with a wound care consult so that they can get bandages, so that they're not worried about something leaking out of their clothes while they're at school. I write a lot of letters for accommodations for 504 plans for kids at school, whether that is to allow them to go to the bathroom without having to raise their hand. A lot of classrooms have rules that say if someone's already in the bathroom, you can't go, or you only have a certain number of bathroom breaks per semester that you can take. Well, if you need to adjust a bandage or if one of your abscesses suddenly starts draining, you don't want to sit there for another 30 minutes until between classes to try to deal with that. So, having that sort of thing on file, having it that they can sit out from PE if they need to, no questions asked, instead of having to explain, well, I have a boil in my groin and I can't walk very well right now. Instead of having to explain that to their gym teacher, they can just say, I have to sit out today. Um, it really kind of depends, and you want to ask the patient, like, what kinds of things are they struggling with at school? They may need the opportunity to make up work. Oftentimes, school doesn't understand that if they're at home, if they can't come in, they're in a lot of pain. And so it's not that they can just work on their work at home and bring it back in when they come back. They might need some extra time to make up those assignments once they're no longer in pain and they can actually concentrate on things. So, really talking with the patients about what is helpful for them and what they struggle with so that you can get them some sort of reasonable accommodation at school and having that conversation early and proactively rather than waiting until the parent reaches out because they're going to have to repeat a grade because they've missed a third of the year, and that can also be a guide as to whether or not it's time to escalate them and refer them for higher care. Because if they're missing a lot of school, then we need to get that under better control. You can also just reassure them. There are a lot of myths about HS out there. There's a lot of different pieces of information of varying degrees of, trustworthiness that are on the internet. So reassuring them that it's not an infection. It can't be spread. It's not contagious. It's not their fault. A lot of times people find that things that say like, oh, it's because you're overweight, it's because you're not cleaning well enough. Those things are not true. We know that insulin resistance can be a huge part of HS, but weight itself is not necessarily directly a cause of HS. And if you lose that weight, it doesn't mean that you wouldn't have HS anymore. So really making sure they can understand those basic things can also help from a mental health standpoint of knowing that this is not their fault. This is not something they caused to happen, can be helpful both for parents and for patients.